time for this weekend's Capitol Report with Pat McGuigan. He's here to talk a little bit about some similarities between Oklahoma and Illinois when it comes to Medicaid. Now, Illinois has embraced the Affordable Care Act, the exchange. Oklahoma has not, embraced the expansion. So talk about the similarities and also the differences there.
Yeah, it might seem contradictory, but what I noticed was the same kinds of issues facing both states. Illinois being a state where the economy has been very moribund, not vigorous at all, and where they face serious government spending and funding problems, where a lot of businesses are fleeing. Oklahoma, comparatively robust, low unemployment rate, actually had income growth for government this past year. So they're different in that sense. Here's how they're similar. I wrote a bunch of data down because it's so interesting. Illinois, this is before expansion of Medicaid under the Affordable Care Act. They need to capture $1.6 billion just to hold their own from their annual budget cycle just in Medicaid. But they've done is a first round review of what one public official called low-hanging fruit, and that is accounts of people on Medicaid that looked dubious, that looked like people that might not be eligible. And in the first 20,000 they looked at, 13,709 were not eligible for Medicaid. They were either making too much money or they had moved out of state. So the state is slowly taking action to remove those folks. But think about that, 2/3 of the initial round. And they believe they're going to find quite a bit more. And then that money at least would be available then for purposes of funding the program. The problem they've got is they're about to expand the program. Since 2000 in Illinois, the number of people on Medicaid has gone from 1.4 million to 2.8 million.
So doubled.
It's doubled in 12 years. In Oklahoma, I'll give some numbers. In 2000, 13% of our population was on Medicaid. Today it's 26.5% of the people.
Here as well.
It's more than doubled. It was from 416,000 up to a little bit over 1 million. So you've really got the serious challenges. Now, Oklahoma has a good program called Insure Oklahoma, which is traditional insurance, albeit it's subsidized through the Medicaid program for the working poor. And there people actually participate by paying in premiums and a copay. Well, guess what? That program is going to go away once Obamacare goes into effect. Obamacare, as people call it. So you're sort of robbing Peter to pay Paul. This is a very serious situation. In Oklahoma, the cost has increased 190.9%. Wow. 190.9% since the year 2000. The cost is now $4.77 billion a year in Oklahoma, and $1.3 billion of that is the state. Now, the governor has been reluctant to expand Medicaid coverage, and she seems to have political support for that. Here's the issue: is you've got the Oklahoma Hospital Association passionately wants her to join the federal expansion, whereas the Oklahoma Medical Association does not. And the reason they don't is they don't see how we don't have the doctor and nurse workforce to cover any kind of expansion beyond where the program already is. So that's the way in which two very different states are similar. I think the word crisis is an appropriate one in terms of Medicaid spending, even before we look at expansion. Okay,
kind of changing gears here, some political celebrity news. Ed Fulner and former Senator Jim DeMint, they're both of the Heritage Foundation. They're going to be in our state in May. Talk about why they'll be here.
Well, the Oklahoma Council of Public Affairs is having its annual citizenship dinner, and this year the award is going to Dr. Fulner. Ed Fulner is one of the founders of the modern conservative movement, certainly a key player at the national level. And he'll be getting the Citizenship Award, which is a cool statue, either of Will Rogers or a scissor-tailed flycatcher, I forget which, but they give that every year to a prominent American. And then DeMint, of course, one of the leading conservatives in the Senate until his recent resignation, and he's taking Fulner's place as the president. that's always an interesting event, and that's coming in early May, and I think it's fair to call both those gentlemen celebrities.
All right. Thanks for this weekend's Capitol Report, Pat McGuigan, and have a great weekend, folks.